have a very provocative title. Is healthy is aging a luxury? So would you give me your definition of aging well and your definition of luxury?
Très simple. Bien vieillir, c'est bien
Very
vivre.
simple.
Et le
Is
luxe,
to
c'est
live
superfétatoire.
well. Luxury is the extra.
Jérôme.
Jérôme,
Moi d'abord, je suis embêté avec
first of
le
all,
terme de bien vieillir.
this
Parce
term,
que ça porte la contradiction. C'est mon
aging well,
tempérament.
and of course I have to bring a
Parce que je
contradiction
trouve que
to
dans bien vieillir, il y a une
our
forme
roundtable.
d'injonction
So we
normative
have here this
qui
normative form
enjoint à la
when we
personne
talk
la
about aging
responsabilité
well. So you
de
have the
bien vieillir. Ça veut dire quoi bien
responsibility.
vieillir? Est-ce que
What
ça
does
veut
it
dire,
mean
ou
to
même vieillir
age
bien? Est-ce que
well?
ça veut dire
Or
vieillir
what
longtemps?
does that mean?
Est-ce que
Does it mean to
ça veut dire
long
vieillir
time?
sans
Does
ressembler
it
à un
mean
vieux,
to
vieillir
not look
en
like an old
apparaissant
person when
jeune?
you're aging,
Et puis je trouve
to
que ça a une
look
sorte d'inversion un peu
younger?
accusatoire en disant
So
attention, si vous ne
we say, be
vieillissez pas
careful.
bien,
If
c'est
you
un peu de
don't
votre
age
faute.
well, then
Alors
it's
il y a une part de
your
responsabilité, comme dans
own
tous les
fault.
comportements de
So you have
santé
responsibility,
de
like we have in
l'individu.
any
Et
kind
moi, ce
of
qui m'intéresse
in
dans le
behavior of an
questionnement sur le
individual.
bien
So
vieillir,
when
moi
we
je
talk
l'écris,
about
y compris
aging
comme ça je réponds
well,
sur le luxe,
and this is why
c'est
I also want to talk about
faire une
luxury as well.
société
So it
de la
means to make a
longévité. Est-ce que c'est
society
un
of
luxe pour
longevity.
nos
Is that
sociétés
a luxury
contemporaines?
for our
C'est-à-dire, quelle est
society,
la part, ça
modern
fait le
society?
lien
So
avec les
in
débats
other words,
sur
this
la répartition de
connection,
l'effort budgétaire,
we have the different
que
budget
ce soit pour des
efforts we've been
individus
talking about,
ou
if it's
des
for
entreprises privées ou pour des
individuals and
acteurs
private
publics.
companies, for
Est-ce qu'on
different
est
public
capable
actors.
de
Are we
dégager les moyens
capable
qui sont
of
nécessaires pour que ce soit plus
getting
une
and
affaire strictement
earmarking enough
individuelle,
resources?
et
So
elle
not
l'est
just an
aussi, mais aussi une
individual
affaire collective,
effort,
ce
or
bien
is it a
vieillir? Le
collective
luxe,
one
c'est
when you
est-ce
talk
que
about
c'est pour la
aging well? And
société ou
luxury,
la
is it for
capacité de s'adapter
society?
au
The
vieillissement?
capacity of
Mais c'est important ce que
adapting
tu as trouvé
to
cette notion
aging. What you
sociétale
said,
par
the
rapport à la notion
societal
d'individu.
notion is interesting
Olivier.
versus
Non, mais vas-y,
individual.
lâche-toi.
Well,
Permettre de parler avant moi.
go ahead.
Pour moi, le sujet
For
essentiel
me,
dans
the
le
central
bien vieillir,
subject
c'est la
of
notion de
aging
longévité, en
well
fait. C'est la
is the notion
compréhension individuelle
longevity.
pour la
The
longévité
individual
individuelle qu'on a, quel capital à gérer
longevity, we have this
de
capital
santé et
that should be
d'autonomie tout au long de
managed.
sa
We
vie.
have our
Et ça peut
own
expliquer derrière tout ce qu'on essaie
health that
d'aborder,
we
qui
should
est
actually
l'augmentation,
manage.
les
And
scientifiques
this
aiment bien
is
dire
the,
ça, de la littération en
in
santé, notre
fact,
capacité à
we
mieux
have
comprendre
our
nous
capacity of
nos
understanding
enjeux à titre
ourselves and
individuel
our different
pour
individual
vieillir longtemps.
challenges so we
Mais en fait,
can
c'est pas le sujet de
live
vieillir,
a
c'est de
long
gérer
life.
notre
But
longévité.
it's
Et
also
c'est pareil au niveau du
to
groupe,
cope
de la
well with our
nation, par exemple,
longevity.
en
That's
concernant la
important.
France.
It's
C'est
also for the group, for
comment
the
on arrive à
nation.
construire
The
l'environnement
same
qui
thing.
va
How
bien,
can we construct an
à la fois
environment that's
social,
favorable
à la
for
fois
the
aussi
society and
environnement au sens
also for the
écologique du terme,
environment in
pour
the
qu'on puisse
ecological
gérer
sense
notre
of
capital
terms,
de
so we
longévité
can really
individuel
cope well with
dans un
our
collectif
individual
qui nous
capital,
permette
but in a
de faire ce qu'on a à
collective
faire, une fois qu'on a compris ce qu'on avait à
approach.
faire.
So
Oui, mais
to do
dans
what
ce que
we
vous
need
dites
to
quand même,
do.
cette notion de
Now,
bien
what we're
vieillir, on est bien
saying
en
to
opposition avec
aging
ces
well,
notions de
this is
dépendance, etc.
opposition of
On est bien dans
dependence.
l'autonomie de la
We
personne
are the
par rapport à cette
autonomy of a person
longévité.
we're
Tu n'as
talking
pas
about
répondu
when
sur
you
le
talk about
logique du luxe, parce
longevity.
que
You haven't
finalement, cette
spoken about
vision
luxury
sociétale que
because
vous
the
évoquez
societal
du bien
vision
vieillir,
that you mentioned
c'est
about
si on
aging
reste dans
well,
une logique de
if we
société,
stay in the
c'est
societal
un luxe
logic,
ou c'est une
it's a
obligation?
luxury or
C'est-à-dire
is it an
que est-ce
obligation?
qu'on n'a pas le choix
In
et est-ce
other
qu'il ne faut
words,
pas qu'on rentre dans cette
we don't have a
société du bien
choice?
vieillir? Parce que sinon, le
In
système
our
pourrait
society, we
exploser.
have
C'est
to
quoi les chiffres
age
clés
well,
qui doivent
or
nous interroger dans cette discussion?
it's not won't be good for
Les chiffres
society. What
clés
are
sont
the
connus et ils sont
key
connus depuis longtemps
figures?
parce
They're
que pour
known
le coup, la
already for a
démographie,
long
c'est
time because
une
demographic
discipline avec
issues
des,
are
on va dire,
known.
des
This is
projections
a
assez robustes.
subject.
Vous savez
We
bien,
have
les
different
années ne sont pas parfaites.
forecasts for
Donc on sait très bien ce qui nous
democratic
arrive
trends. We know
là
what's
maintenant
happening
depuis déjà assez
now
longtemps. C'est
already
plutôt
for
ça la
some
question, c'est
time now.
pourquoi
This is
on
a
parle là
main
maintenant
question.
beaucoup
Why are
plus,
we talking
c'est
about
vrai,
this
mais depuis
now
peu de temps,
more?
du sujet
Yes,
du
more.
vieillissement
We're talking about
de nos
the
populations dans le
aging
monde
of our
entier d'ailleurs,
population
hors Afrique subsaharienne.
throughout the whole
Donc
world. We're talking
les
about
chiffres
this.
clés,
So
c'est
there's
de
key
passer de
figures
22% à 29%
from
de notre
22% to
population
29%
de
of
plus
our
de 65 ans
population of
en
more
un
than
temps très
65
court à
years
l'échelle d'une nation,
have
du fait de 2 décennies.
some 2
C'est de ce
decades.
fait
They
aussi, si
have
tout est
a
pareil,
longer life. So
d'augmenter
everything
malheureusement le nombre de
is, we
dépendants,
have the number
3
of our
millions en 2030,
dependents,
4
3
millions
million, 4
avant
million
2050. Donc
Et quelle est la
before
proportion de
2050.
ALD
So what is
dans
the
tous ces nombres?
proportion
ben,
you're talking about
Marguerite
of
tout à l'heure
these
a dit
older people? Margaret was
quelque chose de
saying
très
earlier
important comme donnée,
something
qui
very
était que
important as concerning data.
on était à presque un quart
We
à
have
terme
almost
de la population
1/4
française sous ALD,
of the
sachant
French
que
population
les ALD, entre guillemets, les patients
that
avec
are
ALD
these
consomment 3
patients
quarts des
that
soins. Donc
consume
C'est surtout des
three
personnes âgées.
quarters
Le plus important.
of
plutôt des personnes âgées.
our
Après, il y
health.
a un autre chiffre,
These
c'est
are the
qu'on sait que les plus de
aged
75 ans
persons. More
consomment
than
presque
75
3 fois plus
consume
de soins que les
almost
moins de
3 times
75 ans.
more
Or, dans
treatments than
ce qui est en
younger
train de se passer dans
persons.
le vieillissement
And this is what's happening in the aging of our
l'explosion des
population issues. We have the
plus
explosion
Je parlais des plus de
of the
65 ans, mais c'est bien
older
dans
person.
les
I'm talking
25 ans qui
about
viennent,
more than
les plus
65, but
âgés
we'll
augmentent
have
en
the
valeur absolue de
older
manière
ones
très importante.
which
Donc, ce que
are
tu
increasing
sous-entends là, en
health
fait, c'est
consumption.
un élément important. Pour moi,
So
cette
this is very
interrelation
important
qu'on est en
because
train
this is
d'évoquer,
a
c'est que finalement,
revelation. In fact, It's for society. This notion of aging well, to maintain autonomy, is really an obligation, because we're talking about these figures. We have the impression that otherwise we will have considerable expenses. Otherwise, as Margaret was talking about, yes, to illustrate this expense, but also the different human resources to support these persons. We have different we don't have enough people that are caregivers. So we need to, if we want to age well, we have to have the attractiveness of the different professions for the caregivers. Prevention, we're talking about that, but also the capacity to really look for different solutions in human resource issues are very important. And to go back on what we've just heard, this subject of divergence between our capacity of having the HR resources to really handle the needs. And so we can also see the trend is going up. We will be now already, we don't have enough human resources for the caregivers. So who do we need for autonomy and staying at home? This is one thing. Are we in, we'll have to have new professions that will come up to support people that are staying at home. First of all, that's a subject. We're at CHAM, aging is not an illness. Aging, and I talk under the coverage of the doctors that are in the room here, there are different pathologies associated. We talk about the room and the space of aging in society. We have an anthropological revolution, civilization revolution. It's the first time that we will have 4 generations living together. The first time we will have a longevity, and we will have working time. In other words, that we'll have an experience. We have longevity. A time period that will be longer nowadays than the professional working period, and also the time that we spend on education. So this has different impact on health issues and society issues. What is the role of the aged persons in our society? We have dominant values, which are dominate, which is speed, profit, benefit, image, where here aging will have terms that will be the wisdom, slowness, and so we have this revolution, anthropological revolution. We talk about this Claude Lévi-Strauss, the longevity, life expectancy is an anthropological revolution, even more than sedentarity. We have this new organization, when people started settling down, and so that was a different anthropological situation. And now here, it's not luxury or not, but are we confronting a crisis for aging? Because not only because of this point, which is a loss of autonomy, dependence, which is related to elderly persons, and also healthcare issues, but will we have a massification of fragilities present in our society? And then we'll have this related to the other previous debate. Adaptation of aging is prevention. And so the person refusal of saying that it costs a lot of money, it costs a problem, we don't know what to do. No, we will have more and more of these elderly person, and they have utility for society. They have fragilities, but they are present in the cities. And so aging then is when we have older people who can no longer use public services. They don't have benches, for example, in their cities. They don't have access to transportation. And then the risk of the society, which is already fractured, and then we have different wars that are crossing societies, and we have the wars of these older persons that are being neglected. So we can say that, for example, we had the benefits of those years of 30 glorious, and now we're in this new situation. So we will have new societal risk with this. And now the subject is prevention, so that the older persons can have this autonomy This is important, as you were saying this, and we have spoke about the round table. There's lots of subjects in the area of prevention, loss of autonomy. How can I stay independent, autonomous? What is the different levers for prevention? We have prevention in different areas. Now we've talked about prevention in the health area. How can we get everyone on the bandwagon? How can we get the older people on the bandwagon? What are the levers so that the older people, they have vaccination, they're vaccinated. There are some older people that aren't vaccinated. What are the different levers so that we can have the last mile that is beneficial? How can we get the older people on the bandwagon? So we have these short time periods. There's two elements of what you're saying. The first one is the when we talk about the European plans, the capacity I was talking about to understand better our subjects, to be more tolerant to behavioral changes on an individual level, to preserve one's health capital and to become and still remain autonomous. So prevention and loss of autonomy are linked together. This is a continuity, it's on a continuum, but the loss of autonomy for most cases is a deteriorated health. These are major chronic issues, major chronic illnesses that have an impact on this. So our health system cannot handle efficiently the stabilization of the chronic illnesses. We have to be careful. Here, we should not, we have prevention, the loss of autonomy, and then we have health issues. But this is a continuum. We have to not forget when we do health prevention, the goal is to preserve one's autonomy. This is really important when we have a vision. What are the three levers? The second element are the different actions. There's lots of things that function well. We know that what functions best is when we have several associated. We spoke about vaccination. This is a preventive measure, and probably the expression is maybe not great, but it's a return on the investment that is very important, even though it's not such a beautiful formula to be used by doctors, but the capacity of keeping one's health capital up, and also for example, respiratory illnesses that can be treated this way and prevented. For me, one point is that we do this too late. The word vaccination at 65 years of age, which comes up quickly, will not convince someone it's too late. We do have a subject of a global vision of strategies that we need to have good communication in public health for prevention. And I take the example of the vaccination. The second element, right now, we're at a situation where we have preventive pathways in a given territory. I give you, when you have prevention, you have to have an individual diagnosis, and this is, for example, already done when we do screening for different fragility issues. For example, at Toulouse, they have done this. Once we give this individual diagnosis, then you said you need to have adapted physical exercise. You need to handle your emotions because this will have an impact on cardiac issues. So where do they send you to do this? Who supports you in this? Where do they send you in the territories? So they said, yes, it's when things are well structured, the communication, and we have different structures that can handle this, but it's not really well structured in the territory level. What's very important also, if we can advance in the area of prevention, we should not forget the fine articulation with the health path. If we're good in prevention, and our hope for us, since the doctor is saying we have to do the early diagnosis and you have to have the capacity of articulating this with different health pathways. How does it articulate with the medical social pathway? Just to bounce back on this, you have, as Jérôme was talking about, you have adaptation of housing. This is an important subject. For example, when there is the possibility of falling if you don't have an adapted housing situation. So the prevention, health policies, adaptation of society, this all are connected, so we can construct something that is very efficient. In the medical social terms, don't be surprised, we do have different responsibilities between the departments. We have the nurses, the liberal professions. No one's speaking to each other. For example, this is finally the opportunity of bringing together all this information, sharing it. Behind all of this, we have to really think, have a future approach. The medical social today does not really have this, it's a fragmented approach to taking, it's not really well coordinated. So we need to exchange amongst ourselves. So we have all the different caregivers and other different actors that are involved so that information is exchanged. And this is for the department that we are creating. This department, we need to accelerate quickly. As of now, we need to raise the question, who is the most efficient and how we can coordinate. So we're going very quickly. Yes? We're progressing. If there would just be one example, we're not going quickly because there's a denial of the urgency of the reorientation of public policies. The denial of aging is an intimate one of each individual and also collective denial of this aging. And this is procrastination of the government, the last three presidents of the Republic, as we have heard from Olivier, the demographic issues are there. We have the forecast, we have the epidemiology issues as well. And so all of this is very well known. However, we are lagging behind. This can be explained, which is also revealing when we hear in our exchange, is this approach, which is a health, medical, social approach. And as we've just heard, they don't understand the real phenomenon. The aging is related to one's territory, where I live. How can I, in 100 meters from where I live, how can I have the certainty of having all the public and private services which will guarantee to me that I can age well? And so here we have different silo approach, unfortunately. The adaptation is something that is not related to those who really take the consequences up of, for example, of bad health. For example, you have the departments, you have, on the other hand, you have the health insurance companies, and then you have prevention, adaptation of aging, you have the transportation policy, housing policy, social links, and fighting against isolation. But we have all these silos, and the one that will be working actually in prevention won't be actually benefit from other offices. For me, in my functions, it was hard for me to have different economies. I want to be a good manager, but I don't have direct competence for the adaptation of housing and the different social housing actors. Then I want you to actually improve your housing facilities. But then he was asking me for more money. So we have municipal elections coming, and in this related, I have a faith, although I'm quite pessimistic in general, but I do have faith in the ingenuity of the local authorities who can really follow up the social housing and other social issues. What we need to do today, we need to coordinate in the territorial level all the different aging policies, and we need to coordinate the different those people responsible so they can help the aged persons that are the most isolated. We have different policies, multifactorial, transversal ones, but for many years now we've had different successes. However, some are going the right. We've had some local security, prevention of delinquency. So we had the police speaking to the different services to have coordination. And another subject concerning education, we did have different local education contracts because Elizabeth insisted on coming up with proposals. One thing that we did, we obliged the different communities, collectivities to have local contracts in the area of aging. So they look at all their municipality policies
and so that they look carefully where would they have an impact for the aging of the population in a positive way. So they do this locally, and at the same time, we would have to have the same steering at the national level. A second proposal is that we need to have an interministerial committee. We have too many, but okay, but there are certain sectors where it's useful to have these kinds of interdisciplinary tools. For example, in the area of disabilities, where the president said, here is the target, and every year, twice a year, we have an interministerial meeting. We should have the same thing. We should have an interministerial committee in the area of aging issues, people that are involved in public transportation and others that are important for aging persons. So because then we have to have coordination, and we don't have to have then that way extra funding for this. So what is your reaction? Yes, we have to re-question. We can't stay in a system today that we talk about luxury. To go back to the debate theme, will I be able to have X amount of money given to caregivers? And there'll be those who think, okay, it's possible. Do we want this kind of a society? We need to construct a society that will enable us to have solidarity. And the interministerial approach is important. I think of this local vector, though. The mayors, for me, have an important role. Planning of housing is done with the mayors. They need to have another higher level actor that pushes the departments for social policy so they can have a territorial planning, which is very important. So this, in any case, territorial planning for the aging population is really an important mandate. And so we tell them, Mr. Mayor, in 2030, 2040, you have X amount of persons that have lost autonomy in your territory. And so they say, oh, I'll bring the young people to my territory. I would rather than say, I have anticipated to adapt to the elderly population, and will I have the necessary caregivers? I would like the mayors to ask those kinds of questions, that they have tools to do this. Now, for housing, the different proposals that are important to me is that we cannot promise all of the French people to live at home, where they're in a capacity of simply having life until their last days. It's not possible for all of them to live at home, but we can have regrouped collective housing, because if there are certain housing of individuals is not adequate, is not adapted, so they have to be in certain residences that are more adequate. So that's important. A lot of persons, especially men, will be living alone. Men and women will be living alone. They'll be isolated. Their children will be far from them. I don't have the impression, Olivier, that this reflection that you're talking about aging well and that health has a gigantic part of this. You talk about the different dependency. We have these different words that comes related to the health area. You in the geriatrics area, as a professional in this area, do we have to reposition ourselves so that we have well, aging is not a luxury, but we want to offer aging well for the most of the population. Yes, our medical disciplinary is a new area. Geriatrics is very new in France. And so we also have the works of different officials in this area. We have the cohort, we talk about prevention, but we're leaders in the medical area vis-a-vis our colleagues who have more of a curative approach. That's a role, to cure people, to treat people. They're specialists of organs, and we have to, it's thanks to them, of course, and to the progress in the pharma industry, for example, and also in the curative medicine that we've had. We are aging, life expectancy is higher, but now we are not prepared, though, for this aging. So it's different geriatrics are thinking of how they can have an integrative approach, how they take into consideration all the different factors, environment, social, etc., clinical, social, environmental, all these different factors. So it's very, very broad definition. And so all the subject of the explosion of these predictive biomarkers of diseases or evolution diseases, we can measure preventive efficacy as well. We have all of these different factors, and environmental exposure also is a real subject for our individual pathways. And also we have these transitions facing mankind. We talk about this, and we talk of strategic planning. It's important of the state, international planning, also the climate evolution, environmental, energy issues. These are so we have the demographic transition, and we're talking about the aging of the stock, excuse me for that profession, but we also have the entry. We have all these subjects that we're talking about. The availability of resources are connected to this. If we modify the system, it won't work. I'm working with South Korea. They're incredible because their demographic transition was very violent, but it's what's going to happen in the whole world in the years to come. Sub-Saharan Africa too. Look at this. South Korea, half of the population will be more than 65 years of age. And so they have have you seen a nation that lost a third of its population in 40 years? So the issue is, how do we handle this population? So the question, is it really a society where we can age well, or will it be a certain number of populations in society? So we have the creation of inequalities. How can we combat the inequalities? And this also is related to the financial issues. When we look at these figures, what we're saying is to really live and age well, how can we avoid and how can we find levers so we can avoid inequality? So this will be accessible to the highest number. We're talking about financing. We're talking about the holistic, transversal dimension and prevention. And of course, we also have, how can we specifically finance the support of those who have the most need at their home or in a nursing home, for example? There are two different schools of thought. Those who say the old people, can you imagine, they globally have resources, they have livelihoods, like a working population. A lot of them are owners of their houses. This was very important versus the working population. So we can say, okay, then people should just handle it themselves. But this is related to a concept of, we have national solidarity, though, and the role of Social Security. We have to take that into consideration. And then we have the other version. This is a new social risk, which will be financed in the different Social Security risks. We should be financed by contributions, the retirees themselves. So this is also the raison d'etre of the CNSA. And so we have something that was just hybrid. It's not just completely Social Security, and it's not strictly the individual logic. We have to be ingenious. We have to have the part with the Social Security has to take its responsibility. And I've heard the presentation this morning from the Cour des Comptes. Each one, they say that one of the public expenditures that will be increasing in years is taking care of the loss of autonomy and independence, loss of independence. And so these are investments, and we need to anticipate this. And the day that we have the massification, and so we look at 2030, 2040, will be doubling the number of people that are in their 80s. We go from 2 million to 4 million, more than 85 years of age. Most of them are fragile and they have lost autonomy. So we have these issues, and we don't forget all the different fragile ones. So in other words, we have the society what does not, in fact, we're talking about prevention of falling, for example. We need to anticipate. We need to do something against falling because we have a lot of people dying because of the falls. We can't say just it's a fatality because they're old. No, we're capable in 40 years to divide by 4 deaths on the road. And so there was not fatality that we were able to do this. So when I was born, we had some 17 million, X amount dying in traffic accidents. And it's not just a fatality. We have to have a social approach. We need to mobilize what is the lever that will enable us to avoid having just an individualistic approach, saying you have your own your own goods. There'll be a temptation to mobilize in the financial crisis, which is the inheritance. Is there's a justification today? And also we had the Vacher report when we have the branch that was created. We have X amount of deaths in the comes to come, so we'll be in all this inheritance, and they're only taxed by 5%, so 20 billion coming from the inheritance. So this would be mobilization of collective approach. And so very concretely tomorrow, and I'm convinced that we can get a supplementary funding because we have from the inheritance issues. So also the retirees themselves, we assume that more that we have the risk of loss of autonomy, the more the contribution should be mobilized. In other words, these are subject solidarity, not just intergenerational, but within the generation. This is something, when we talk about this intergenerational approach, it's very important. But when we talk about the loss of autonomy, we talk about housing, it's important. The nursing homes is not just medical treatments, but here people go saying that if I go to a nursing home, I won't pay a rent, but we're moving to a nursing home. It's not complicated. There's a concept. It's not Social Security that will be guaranteeing our stay in the nursing home. So we have the liquidation of our inheritance. We sell our main residence so we can ensure our residents in a nursing home. This will enable us to finance the level of rent which is higher at the nursing home than at your home. And also you have the fact that the territorial collectives can help those who have less wealth. So we have Social Security, universal, and normally we should also start be questioning the contribution of different plans which are connected to income. So when we talk about the different national fiscality policies are very important. So we have contributions and also the different inheritance. This will actually pay for these different additional supplementary health. You also have different adaptation of housing. So we have to have more equity. So these are different contracts, property contracts that have to be developed. Olivier, it's interesting to have your point of view. 1 minute. I will be talking about something different because I could answer better on this other point. Yes, planning is very important. This is and the transformation that we have in life expectancies, all these different subjects, we hope they will cost less money if we're good now and compared to 20 years. So we have also this effect. We have the baby boom, and then become the pappy boom. This is also a time period. And then, and I go back with South Korea, they see the vision that they have a deep transformation on different health, autonomy, and productive issues, digitalization of their world. It seems to be just incredible, but it's one of the potential hypotheses to actually be able to survive the shock. We will I'm not going to give you the three. Okay, you have the three key words about aging well. We're talking about what are your three key words. You spoke about South Korea. Cite a country if you want. Sweden, anticipation. Let me see. Housing. I'm persuaded about that. And attractiveness of the medical field. Olivier?
Le Danemark.
Denmark.
La planification.
Planning.
Et l'espoir dans la science.
And hope in science. I'm like René Rousseau. It makes me feel good to speak here. And I want to say the preliminary for all this is they all are convinced, but you are. The old people are not in another category. Here we're only old people in this room, and aging is universal fragility. If we talk about this universal fragility, we can handle all the other issues. The only country is France that we're talking about here right now. Thank you.